Cancer, diabetes, obesity, hypertension, and asthma are all examples of non-communicable diseases, and sadly, these diseases are the leading cause of death globally. But do they really affect us here in Africa? And are Africans really living with these diseases? Find out here at the African NCD Champions podcast as we share incredible stories of Africans living with non-communicable diseases. My name is Ogweno Stephen and I'll be your host. Let's roll.
Alright, thank you very much for agreeing to be hosted today on the podcast. Talk about your experiences as a caregiver for someone living with NCDs, which we'll get into, but also experiences during COVID-19 and what lessons we could learn from that. And without further ado, give us a brief of an introduction to yourself. Who are you? What do you do? Let's go.
Okay, my name is Eldah. I used to do research, but during COVID, my job went off. And now I'm a business lady. And for now, I live with my mom. She had stroke on 2020, January. That time I was not around, but I was called. She was taken to Mbagathi first. When I reached in Mbagathi, she was not talking. And I was told that she fell down. She had a shock. She fell down and she was having something like saliva coming out from her mouth, and she was all over wet. Then when I was in the hospital, she was not talking. She was just mumbling. And at that time, we were given some blood tests. We went and do the blood test. But at the same time, we had her card because she was attending her clinics at Kenyatta. She's a cardiac patient, arrhythmia. Then at that time, when she was there, the nurse didn't tell us that at Mbagathi. She didn't tell us that she had stroke. But at that time that I went and buy medicine, that time when we were told to take her home, but still she was not talking. At that time when she came conscious, that time at the hospital she was unconscious, but the time she regained conscious, we were taking her home. That time when we took her from the bed, they wanted to help her walk because she was heavy. I saw her limping. That time I realized she had stroke. Okay, on my side, I knew about stroke because I had mild stroke on my face, one side of my face. Then we took her home, but when she didn't talk, we decided to take her to Kenyatta. That time they told us she had stroke and she stayed for 1 month. And we were told that she's having a blood clot. We continued with the medication, and as I'm talking, she's at home. Yeah, people with stroke, sometimes they feel uneasy, sometimes they feel that like they are a burden to people. But if as a caregiver, if you can't listen to her or show her that helping hand, she calms down. She feels like she's a burden. So sometimes we have to bembeleza them. Yeah.
All right. So I'll ask you a question about that, but also about your previous work with research. What was you doing with research?
Okay, I was working with KDI. The organization is an NGO, and in full it's called Conquer Design Initiative. They deal with public spaces in Kibera. As I was working as a research team, as a numerator. We were working on flooding. But at the same time, I was not working on flooding. At the other time, I used to work on there's a new road there. So we used to go there and ask some few questions. We wanted to know how the road has affected the people who are living in Kibera. Yeah.
All right. Interesting. Now back to your mother's stroke experience and even your own mini stroke experience. So even just from your mother, I guess my first question would be, having seen that journey through from her getting stroke the first time and sort of her condition at the moment, what would you say has been the biggest transition for you as a caregiver?
Okay, on my side, I didn't take it as hard, as a burden. I just let myself go and decided to learn more and to know how to take care of such kind of issues. Okay, on life experience, my mom, she's the one who has raised us. We have passed through difficulties. So I came to know we are on our own. So I have to show her that she's not a burden to me. Yeah.
All right. So during COVID-19, because it's very interesting that your mom got stroke during the pandemic. So how was it like with access to medication and drugs and services? How was that? Like, what are the challenges that existed during that time?
Okay, during COVID, at that time I was still working, and I was working at home. Yeah, and when it comes to medication, sometimes you go to the chemist, you are being told we don't have this medication. Now you just have to go to Kenyatta. And in Kenyatta, sometimes you can't find that medication. You are being told go to Casualty. Yeah. And during clinics, it was a bit harder because at that time you are being told be careful of the patient that you're having. And the patient was scared because, okay, that year, we went back to we were admitted 3 times, different months. On March, was it March? Yes, that time COVID was high. That time she was sick. I didn't know what was wrong because her condition. At that time, when we went to the hospital, I and her and her friend, but her friend left me because of the, what do we call it, that duration of time.
Visiting hours?
No, not visiting hours, because we were in Casualty.
Okay.
Curfew.
The curfew
yeah,
now.
She left me. I was with her. Then that time, you know, in Casualty, there are many people, and yet you are being told she's at risk of getting COVID. At that time, we were there, but I was me and her, so I had to leave her somewhere, and because she doesn't go down, she was just bed rest. That time I was scared at the same time, but I had to show her not to be scared, because at that time the file was not able to be traced. Now the doctors wanted to tell me that she has COVID, and I stood with my side because no one was going out from the house and coming in. That time then the doctors wanted to tell me that she's going to be put at the
facility.
Yeah. They told me not to tell her, but I had to tell her, and I had to tell the doctors she's a patient in Kenyatta. That time, the one doctor, he wrote suspected, but at the same time she rubbed. She asked me, have she ever had, which one is this? Has she ever had pneumonia? I said no, but previously at the history, I was told that she had TB, but it was long time ago, 90s there. And they didn't tell me what was happening. When she was put on the facility, I became angry, and I told the nurse you should tell me everything because I have to know. Even her, she has to know because she's looking at us. The more she gets worried,
The more she becomes even sicker.
Yes. But one doctor came on my side and tell me everything. I had to tell her that it was the previous day after. I've spent there 24 hours. I told her I'm going to leave you in this room and for some until they want to check on the COVID status. Then we'll go home. I told her like that. Then I had to leave her. At the same time, the doctor told me not to be worried, and then I'll come the following day to check for the results. So I had to be there the following day. We found she was negative. Then she was taken to the ward because on her condition she couldn't go home until the doctor sees her. From there, the same year, on December, she was not eating. The due date for the clinics, because the clinics were prolonged, she got sick at the middle. Then I went to the clinic. They told me not to go to the clinic, to go to the emergency. I went to casualty. That time they told us to go, they admitted her. After a week, waiting for the doctor's results, one doctor called me and asked me if she has TB or pneumonia. I said no. Then, because she was coughing blood. Then the doctor, after a week, the doctor told me that she's going to quarantine. She had COVID. But they are not sure. But I had to tell her. They were telling me not to tell her. I had to tell her. After that, she went there for 1 week, but she was stressed. And now she went home after, it was on December. We went back to the clinic. We went to the COVID clinic. The doctor asked about her condition, about even the other clinic. After there, they didn't tell us to go back to the clinic, COVID clinic. They had to refer her back to her own clinic. Yeah, it was a long journey.
It was an interesting long journey, and even you narrate that, I see how long that was and stressful.
Yeah.
Yeah, so I guess then the question would be, have we learned anything? COVID is now beginning to go down and measures have been relaxed. Have we learned lessons from there? Do you think that there are lessons that we've learned, and if yes, what are those lessons?
On my side, I'll say yes, but not all of us, because some people are ignorant. Yeah.
So the question then would be, what do you think are the lessons that we've learned, and how can we then be better prepared as caregivers, for example, to take care of our patients during another pandemic?
Okay, during another pandemic, what I've learned, we have to show them love. We should not disclose them. Because when a patient sees that you are disclosing the person, he or she gives up. So we have to show them care and love. Yeah.
And so, final question then, what is it that you'd want people to understand about roles of caregivers, and especially during times like the pandemic, where the roles become even more important to patients or people living with these conditions? What do you want people to learn about being a caregiver and what the experience is like?
As a caregiver, what I'll just have to say, it's someone to be strong and to be able to endure everything that comes his way. Yeah.
So you need to be strong, you need to be endure, but you also need to show love to the patients throughout.
Yes, and we should know how to hide our emotions. Yeah, because the patients always read someone's face. Yeah.
So they look at your face, and if you're not strong, they lose hope.
Yeah, they see that you're hiding something. So you should not show them that you're hiding something. Yes, should be open to the patient. Yeah, and know how to counsel the patient so that he can accept he or herself. Yeah.
All right. Well, thank you very much for agreeing to come on board. It's very interesting to learn from a caregiver's point of view, because most of the lessons here have been from the patient side of it, so it's very refreshing as well to hear about that and also to hear about experiences. Hopefully we'll be hosting you next when you do another podcast series, and then we'll talk about yourself and your mini stroke and some of the lessons you got from that. Yeah, but otherwise, thank you very much for agreeing to come, and yeah, it's a wrap.
Thank you too.
Now that was incredible. Thank you for listening in. Share this with your networks and follow us on all social media at Storylink and at NCD Champions. See you on the next one.